Whenever you're ready, Don.
Good evening. Welcome everybody to tonight's meeting of the Finance Committee of the New Haven Board of Alders. We shall begin by reading the public notice. Board of Alders notice. The Finance Committee will hold a public hearing on Monday, January 13, 2025, 6:00 p.m. in the Aldermanic Chambers, 165 Church Street, New Haven, to hear the following. 1. LM 2024-0516. Order of the New Haven Board of Alders authorizing the City of New Haven, Mayor, Comptroller, or Budget Director, to extend at no cost the multi-year agreement with Yale University, A22-1176, in the amount not to exceed $3,513,842.00 for 1 year through June 30th, 2026, to continue implementation and operation of the Elm City Compass pilot program. 2. LM 2024-0661. Order of the Board of Alders of the City of New Haven authorizing the execution of a multi-year agreement with E-Rate Online LLC with the Board of Education for the period of July 1st, 2024 to June 30th, 2027. 3. OR 2024-0035. Ordinance amendment to appropriating ordinance number 1, reclassifying the titles of procurement analyst and contract analyst to procurement specialist. Item 4, OR 2024-0036. Ordinance amendment to appropriating ordinance number 1, reclassifying one dispatch/operator 3 position to communications supervisor within the Department of Public Safety Communications, and reclassifying CADD technician to engineering data and geospatial analyst within the Department of Engineering. These items are on file and available for public inspection in the Office of Legislative Services, 165 Church Street, per order, the Honorable Adam Marchand, Chair, attest Michael Smart, City Clerk. If you need a disability-related accommodation, please call 3 business days in advance at 203-946-7651 voice or 203-946-8582 TTY. Public comment/testimony may also be submitted via email to publictestimony@newhavenct.gov before 2 p.m. on the day of the meeting. The meeting may be viewed on the Board of Alders YouTube page. We'll continue with introductions from colleagues, starting to my right.
Alder Jeanette Morrison, Ward 22.
Yvette Hamilton, Ward 24.
Sal DiColo, Ward 18.
Adam Marchand, Ward 25.
Sal Ponzo, Ward 17.
Anna Festa, Ward 10. Taisha Walker-Myers, Ward 23.
Thank you everyone who's here. We have 4 items that are all public hearing items. We will hear each one in turn in the order in which they were read just now. So the Elm City Compass first, then the E-Rate second, then the procurement position reclassifications, and then the public safety communications and engineering reclassifications. After each item is presented by the maker and questions are asked by the committee, we will then offer the public an opportunity to comment on these items. When any of you come up to speak, whether you're a presenter or a member of the public, please begin by giving us your name and address for the record. And it's best to speak somewhat close to the microphone and to move it as little as possible. If you have phones or other devices that make noise, please shut them down or put them on quiet mode. And we thank you for your cooperation. We'll now begin with item 1, the contract with Yale to operate the Elm City Compass. Would the makers please come forward?
Good evening.
Good evening. Lorena Mitchell, 107 Foster Street, New Haven.
Tears Kemp's, Mix Avenue, Hamden.
If you have paperwork you'd like to pass out, why don't we get that done from the start? So there are 2 different documents?
Yes.
Okay, so we'll make sure we get all the way around.
Perfect.
I'm getting to it.
So we're here tonight from the Department of Community Resilience to request authorization to extend the Elm City Compass contract with Yale University. This was a multi-year agreement that already came before the board. I'll direct you, well, briefly, Elm City Compass is a community crisis response team embedded in our 911 and emergency response system. It is staffed by a social worker and a peer with lived experience of a mental health or substance use challenge, and supports the work of fire and PD in New Haven to respond to community crises related to mental health and substance use, as well as housing insecurity and other psychosocial needs. The original contract, Yale University was selected as the most qualified contractor through an RFP process. And the contract dates started May 1st, 2022, and is set to expire June 30th, 2025 this year.
I'm going to interrupt you real quickly just to make sure. I think you're reading from your presentation, correct?
Yes,
So what page are you on and what slide is it?
I'm on page 4.
Page 4.
Thank you.
Just to make sure that colleagues know where you are.
Yes, sorry. In the slides, page 4.
Okay, thank you. Please continue.
And I'll direct you now to page 5. So our request this evening is to, at no cost to the city, extend the contract date from June 30th of this year to June 30th of 2026. Yale University has been a responsible fiscal steward of its funds, and there has been some unspent funds from years 1 and 2 of the contract that we'd like to roll over and extend, as I mentioned, no cost to the city for an additional year. The scope of the contract will not change at all, so the work that they're completing will not change. The extra year is really intended to provide more time to continue to implement the program and to ensure that we have as much data to evaluate the program and give us a little bit more time to plan for long-term sustainability as well. That was a very brief presentation. I'm happy to answer more questions from the slide deck, and you also have the most recent City Compass report that is published monthly on the Compass website with the latest data about crisis response and what the team has been doing.
Do you have anything you wish to add to the presentation?
Not at all. Since my position in being here and working so closely with the Compass and the Compass team, everything that we do when we're responding to crisis in the community, substance use in the community, is really in partnership with Compass and their team. And so I'm very pleased to be here and asking for this extension.
Before we go to questions from colleagues, I'll just point out that obviously this item is a request for authorization to extend the contract. No cost, because the residual funds will cover the year in question.
Yes.
But the question that one might ask is, you mentioned that Yale's been a good fiscal steward of the resources. but has Yale been a good partner to deliver the services? What more would you say about that? Because part of what we would need to evaluate as a committee and as a board is, you're asking to continue the partnership longer. How has that partnership been helpful? How have they been successful in driving these programs? Why are they worth continuing to work with? I suspect you'll hear different versions of that question, but it seems pretty obvious thing for you to be addressing up front.
I can absolutely speak to that. So as the director of the Department of Resilience, I oversee the Office of Housing and Homeless Services, the Office of Violence Prevention, and the Office of Housing and Homeless Services. And what does that mean? In every aspect, there's crisis under those offices. As we know,
Just push it back a little.
okay.
Thank you.
You're welcome. We do have a homeless issue here in New Haven across our nation, and really being able to support the homeless population. Is it the microphone? Okay.
Some microphones have these little covers, others do not. The ones that do not are a little bit finicky. So
Okay,
just do
I'm
the,
trying to behave.
it's not your fault.
And so when we think about our housing, our homeless population, there's definitely underlying issues that impact these individuals, such as substance use, as well as mental health. And so being able to call on Compass to be able to assist in making sure that those folks are getting the services that they need, being able to be placed. The other thing about Compass is they're also able to immediately get somebody onto the CAN list, the Coordinated Access Network. So if we do engage someone who is not on the CAN list, we're able to, Compass is able to do that, and not a lot of providers have that ability or that capability. The other thing is when we think about our downtown merchants, our businesses, and how they're impacted by individuals with mental health. We work very closely with our downtown merchants, economic development. They work closely with Compass to be able to come and respond. We also, Compass provides training. They've offered training to the downtown merchants and other community providers so that they're aware of Compass and the role of Compass. We think about public drug use. It's Compass that is responsive to the needs of those individuals, again, getting them connected to the services. And so really Compass has worked with us, whether it's homelessness on the green or throughout our city. We call them at a week's notice. So it's been a wonderful partnership and something we would like to continue. Okay.
I would also add, as the coordinator for mental health services in the Department of Community Resilience, we work with many contractors. I think I oversee 7 contracts, and Compass is continually one of the most organized, timely, efficient, effective, transparent in their reporting. It's just, they're excellent partners to the city and really delivering on the scope of the contract.
One more thing I would add is, as we know, with the emergency cold weather that's happening, we have individuals that are at the warming centers that sometimes the warming centers are over, they have too many people, and Compass actually comes and provides the rides and provides transportation to get those folks to additional beds and shelters within the community. And so they're responsive for whatever we need for them to do.
Thank you for that additional information. We'll now have questions from colleagues on this item. I see Alder DeCola, then Alder Morrison.
Thank you. Thank you for your presentation. Question, I've been hearing on the news that homeless population has grown in America. How much did it grow in New Haven? Do you have a number? Do you have an idea?
I don't necessarily have an exact number. I know that it has grown. Actually, the population that's grown the most is our elderly population. So we're really focused on that and our families. And so I want to say roughly a little over 100 from the last numbers that we looked at. But again, the way we separate and kind of individualize, we have families and then we have individuals. But definitely we're seeing an increase in our elderly population.
Okay. Thank you, Mr. Chair. Alder Morrison.
Thank you for your presentation. I'm so happy this is all working out so well. So I just have a couple of small questions. I know in the beginning of this process and the partnership to work out of 911, that was something, it was a little scary, right? And so I'm wondering, how is that communication working out? Are they still sending out a police and Compass at the same time and then realize, okay, we don't need the police? Or are you guys at a point where it can just be a 911 call and 911 says, okay, Compass, you need to go out versus involving the police at all?
I'm so glad you asked that question. This was a pilot program. We're still moving through our pilot phases. And so as you point out at the beginning, whenever there was a call that was appropriate for Compass, police and or fire would still be on the scene as the team was getting used to responding to these types of community crises. We're very excited, and you'll see this represented by the number 72%. These are calls that have come into PSAP, and shout out to some of our PSAP colleagues in the room who've been wonderful partners. These are calls that are coming directly into 911, and Compass is able to go out now without police or fire once they've been triaged by the 911 responders. So we are starting to move towards that, knowing that that's what the community wanted from the beginning.
Great. So additional training has been provided to the PSAP staff to be able to do that. And okay, have you gotten any feedback in regards to that difference? Or people probably don't realize you all realize.
Right. Hopefully it's operating smoothly, that our residents maybe aren't even noticing that there's been that shift. There was a lot of conversations around making sure that the types of calls that were triaged directly to Compass were appropriate. But from what we've been hearing from our PSAP partners, PD, Fire, and the Compass team, everything is going really smoothly.
Great. One last question, Mr. Chair. In regards to I see your maps, but outside of the green, because everyone is always focusing on the green, what are your major areas of concern that's utilizing this service, or is it just spread out throughout the city kind of evenly? Again, outside the green, because I know you guys are there all the time.
I'll briefly respond and then pass it over to you. I mean, I think what we've seen is that people have crises across the city. And so the maps do show you that the team is responding to every single neighborhood and every single ward. In addition, the team makes some concerted efforts to be present at other areas around town, providing outreach, driving around in the recognizable green van to provide services. Some of those areas, Fairhaven, Grand Avenue, the Hill by the Wilson Library and on Congress Ave, are two places that come to mind. I'm sure that there are other places as well. Maybe you want to chime in?
No, I absolutely agree. That's exactly what I was going to say. I'm leaning towards more of the Fairhaven Hill areas. I also just want to kind of lift up the coordinated effort that it takes for Compass to actually be successful. And so, yes, it's Yale when it comes to our fiscal sponsor, but then we also have Continuum of Care. We work closely with all of our shelters to ensure that we have transfer of individuals, our rest center through Continuum, 645 Grand Avenue that we just lifted, and then just all of our partners, the city of New Haven. So it's definitely a coordinated effort to kind of make sure it's seamless. And then shout out to Joe Vitale and his team. PSAP has been incredible and really, first of all, learning about Compass and understanding what Compass does, but then buying into the necessity our community needs in addressing mental health crisis.
Thank you.
Thank you, Alder.
Thank you for the work.
Thank you.
Morrison. Next will be Alder Festa, followed by Alder Walker Myers.
Thank you, Mr. Chair. And thank you, obviously, for all that you do. I know we work with the Fox and Cab. Question is, what is the number of Compass employees that we have that actually go around, and what are the hours of operation?
That's a great question. Currently, I'll speak to the hours of operation because I know that definitely. The team, since the beginning, has operated 7 days a week. We are now operating from 8 a.m. until 3 a.m. And there's 3 teams. There's a little bit of overlap between second shift and third shift, I think around like from 5 to 7 p.m. or something. There's 2 teams operating. And that was all driven by usage data. The number of staff, I can't speak to, but I'd be happy to get more information. The team itself is a subcontract to Continuum of Care. The team always has a clinician, like a social worker or psych APRN, and there's always a peer, so somebody with lived experience. Continuum is a big agency in New Haven, so there's certainly a core group of people who are always on the Compass team, but I know they also pull from their per diem staff to make sure that there's coverage at all times.
Okay. And you also mentioned we work closely with other partners because we have Liberty and we have Columbus House and we have all of those outreach workers. Do we collect data through them as well that make up these numbers, or is this strictly Compass?
This can be strictly Compass and a call that they're called on. However, yes, they do much work together, especially when we think about our encampments in our community and how we're addressing the needs for those individuals. And so Compass has their own numbers, they track these numbers, and then this is the result of a Compass call.
You mentioned that we have expanded to other parts of the city, because generally folks are always like, why is it always downtown and not in other areas of the city, which is, a concern because obviously the whole city is affected by some of this one way or another. And then, when you hear that Yale is the main funder, you think, oh, they're just trying to protect their downtown, their area. So what, is there, because I cover a little bit of Fairhaven, I just get complaints in Fairhaven that Compass needs to get in there more because of some of the prostitution and drug addiction that you see in that area. So some of the folks feel like there's not much attention to them. Is there any, I don't know if you can speak on that at all.
What I can speak to is we did get many complaints about the open drug use in Fairhaven, and Compass immediately, we worked together. We had meetings and kind of discussed the outreach and the engagement in specifically Fairhaven. So I am familiar around the Ferry Street area. Could we do more? Yes. Can we expand? Yes. Do we need more money? Yes. And that's what we're working on, and that's really why we are asking for the no-cost extension, so we can spend more time on sustainability, and we're already talking about that in our upcoming budget and how we can expand on the Compass services, because it is a success, right? And now I'm realizing how much it really fits into our larger system and the need for that immediate crisis response in many different areas. So first we were just focused on mental health, right? And now we're realizing homelessness and as well as the public drug use. Mm-hmm. And so we're gonna definitely be focused over this next year in expanding the work of Compass.
And then just, question regarding something here about delays in executing a data use agreement with the city of New Haven. What were the delays and what, data is obviously something, we're all data driven. And this is kind of a little fracture in the whole data output. What is the concern there? What is the delay?
Our attorneys, the attorneys back and forth with Yale language in the agreement. However, I'm so pleased to say today, the agreement has been executed. Okay. And so then it was whose hands is it in? So finally I got an email and was like, okay, I've been enough of this back and forth. And we actually were able to get everything signed today. So the data use agreement is executed.
And what will that data show us? I mean, we have data here.
Yes.
What will it be compared to this?
So our partners at Yale, and we keep saying Yale, specifically it's the Consultation Center, which is a community-focused research institute. They will be able to, I'm not a research scientist, so I can't speak to all of the analysis, but they're going to be getting a data set over time from the city of New Haven and hopefully being able to do a comparison of those who were served by Compass and a sort of control of people who were not, a similar population who were not served by Compass, and looking at outcomes over a period of time. So sort of the highest level of research to show effectiveness. We're hoping to show effectiveness, but the data will ultimately, help us decide what the next steps are.
So I guess we'll look forward to those reports down the line once you start collecting this data, and we'll all have a better understanding of it as well. And just one last one that just came to mind. Do we collect data on where these residents reside? Are they New Haven residents? Are they outside of New Haven? Because we know that people come into the city, do their business, and then, stuff happens. So do we collect that data?
That's a great question. I think to the extent that we can, we do. A lot of our data is coming through 911 through PSAP. So to the extent that people are getting addresses and residency on the phone, maybe. Also, once the Compass team is engaging with somebody, it may be appropriate to find out if they're a New Haven resident, if they live in New Haven, how long they've lived in New Haven. But if that isn't necessarily relevant to the crisis at hand and it doesn't come up, then that data may also not be collected. But we certainly are, the team is collecting and recording as much data as possible. And I will also say, if Compass isn't collecting the data, we do have all these other partners, the outreach teams who may be engaging with someone when it isn't such an acute crisis level, who are in a better position to ask those types of questions.
Okay. And I only ask that because there's funding that's involved with this. And if we have, residents of Connecticut that are coming into New Haven, then, that point needs to be made, because it can't just fall on the city's responsibilities, if you know what I mean. And that's not to be insensitive, or it's just unfortunate that we have to think that way.
Thank you for that.
Yeah,
I agree. Thank you for that. And New Haven is kind of known for a city that is very rich in resources, and we're good at what we do.
Right.
But you're absolutely right. And I feel that when I'm working with the homeless, when we think about the railroad station, when we think about these particular places, who are these individuals? Where are they coming and going? And so all of our shelters, our partners, we are collecting that information, including in our warming centers.
Okay, and that's appreciated. Again, it doesn't mean that we're not taking care of these individuals. All humans deserve to be taken care of, no matter where they come from. It's just a matter that our neighboring towns need to hear this, because we need the funding to help them so they can help us.
I agree.
Thank you.
Wholeheartedly. Thank you.
Thank you, Mr. Chair.
Thank you, Alder Festa. Alder Walker-Myers.
Thank you, Mr. Chair. Thank you for your presentation. I saw the Compass team in action in my neighborhood firsthand. It seems like they're there often in the homeless encampment that I have. So do it just come from 911 when the Compass team show up, or do you just come back because they're there often with that group of individuals?
So it's a coordinated effort. And so we do have an outreach worker who really is kind of in the know of all the encampments. We work, we monitor See-Click Fix very often. I know where you're talking about. And so it's really the outreach worker that will coordinate. If this outreach group is not available, then we call on Compass. Compass will come out. We never go to do an encampment alone. And so Compass is kind of a partner and they'll come out no matter what. And so a lot of times she's reaching out to the Compass team, hey, I have this encampment, or hey, I'm gonna do outreach. The other thing is regarding the encampments, we do try to do 3 outreach attempts. And so sometimes the bed is gonna be ready, say next week. And so we're just engaging those folks, hey, your bed is about to be ready, are you ready to go? And so Compass comes with us to do all of that.
So you know the group I'm talking about, they're not taking a bed, you're gonna go back there. Kind of
Right.
But it kind of just amazes me that they know the names of the Compass workers and everyone that come out to service them. So I was really wondering, does that happen in other places where everyone's really familiar with the individuals that they're dealing with?
I saw it downtown, just recently. Yes, they know who they are, they speak their name. And I think it's wonderful, right? And because there's a relationship there. They know what's going on with the individual, what the issues are. They'll say, hey, did you pick up your medication yet? Or, you know, so I've seen it in a lot of the areas that I've been in, absolutely.
And I think it's sort of been stated in many ways, but maybe to be explicit, one of the strengths of Compass is that it's almost 24 hours, where many of our outreach teams are 9 to 5. And so I think Compass can be places late at night, early in the morning, when the train station is closing. And that's a huge asset to fill in the gaps in our other outreach systems.
Thank you, Mr. Chair.
Thank you, Alderman Myers. Further questions from colleagues? Before I take any further questions, let me recognize our colleague, Alder Frillo, who has joined us. Further questions from colleagues on this item?
One question.
Alder Morgan.
Thank you. In tonight's request, you're just asking for the 1-year extension. And so once you get your 1-year extension and you figure all that stuff out and get all that great information, is the plan to come back at the end or close to the end of that year to ask for, is it a new grant? I'm not exactly sure, because I know Yale is a big funder, but the city also provides supports. And so, and if there's a multi-year contract request, it definitely has to come before the board. And so I can't remember how. So of course, this contract was, I guess, 3 years. You're asking for an extended year. And so if you are gonna come back closer to the end of 2026, if this is approved now, would you be coming back for another multi-year? Would it be more than like a 3-year contract? Are you looking for a 5-year or 10-year, something like that? Or are you guys thinking about that yet? Because I know you want to get to this point first to be able to continue to function for another year.
Yes.
So that was a
Yes.
multi-tiered question.
No, yes, yes to all of that. We're having a lot of conversations right now about sustainability and what that looks like. And we would love the opportunity to present to this committee and to the Board of Alders to provide more information about the program, what our vision is for future years, and how that might be funded.
I would be open to even doing a workshop. We didn't talk about the Community Advisory Board of Compass. There has been some additional funding has been leveraged for towards additional evaluation, as well as the Community Advisory Board. They're talking more about legislation and going to the state level around homelessness here in New Haven. And so I would be open to actually possibly doing a workshop. And then I think about the roles that all of our alders play in your community and for your constituents, even a training if you want to like kind of learn more about how to reach Compass, calling 911, who do you ask for, how do you ask for it, whatever you guys need, I'd be open to doing that.
Absolutely.
Thank you. And through the chair, if we can maybe look at something around a workshop, because the information is very helpful. As stated, all alders are affected by this, and the more information that we have, the more empowered we are, the better we can serve our community.
So noted.
Thank you.
Further questions from colleagues? Seeing none, we thank you for your presentation.
Thank you.
We're now gonna see if the public wants to chime in on this topic.
Thank you for your time, everyone.
Thank you so much.
Don't leave just yet because of the question. I mean, you may sit,
Yeah.
but don't
Understood.
leave the room because what if we need to ask you something?
Thank you.
Thank you. So, is there a member of the public who wishes to testify on this item? If so, please come forward. And so for a second time, is there a member of the public who wishes to come forward to testify on this item? And a third time, is anyone from the public wishing to come forward to testify on this item? Seeing none, we're going to proceed to the next item, which is a multi-year agreement with E-Rate Online LLC. Good evening. I see you have a colleague coming forward.
I've asked Sean Garrison for,
Great.
haven't done this before.
Thank you. So when you're settled, please give us your names and addresses for the record.
My name is Christopher Brown, Olive Street, New Haven.
Sean Garris, Southington, Connecticut.
Floor is yours.
Again, I haven't done this before.
We probably need you guys to come a little bit closer so that folks can hear you. Thank you.
All right, so E-Rate Online LLC helps the Board of Ed, New Haven Public Schools with funding for technology to provide internet to students across the district, amongst other projects with hardware, networking, Wi-Fi, switches, and most recently cybersecurity. So this request is for a multi-year, 3-year, for $35,000 a year to total $105,000. Not sure what else I should say.
Well, I mean, it's very concise and we're grateful for that. This committee has heard requests in the past in regards to E-rate discounts. For example, the New Haven Public Library System uses the E-rate system to provide internet services to clients at a massive discount. What you're talking about is a nonprofit entity that assists the Board of Education in applying for E-rate discounts from the federal government.
Yes.
So the group, so it's not an actual E-rate arrangement that you're talking about. It's a nonprofit that assists the Board of Ed with applications.
Yes.
And it's $35,000 a year for 3 years. And I guess the question that would be obvious is, could you say more about what kinds of services have been obtained with their assistance and what kind of discounts we've been able to get so that we can judge the return on the investment of this company's help?
I can only speak to what I know of. I'm the acting director of IT for the Board of Ed. I've been here since February. I don't think any projects have happened since February, but I know E-Rate did work for Total Communications, which is a vendor. They helped replace UPSs, which are backup batteries, supplies that keep the data closets running, which keep the switches powered. They helped with switches. They've helped with Obama School, the networking throughout the school, Wi-Fi for the students throughout the schools. Examples like that, is that what you mean?
Sure, yes.
Mr. Chair, I interject. Sean Garris, the Deputy Purchasing Agent for the City of New Haven, and the group provides a consultation service as you elaborated. They basically assist in developing the specifications and reviewing the postings of what's needed on the website for E-rate activity. I believe they basically, as Chris has stated, they have developed the specs, outline what's particularly needed, whether it's networking, telephone services, hardware items. They basically assist in outlining out the documents should be structured, and then they review for meeting the requirements of the feds and the funding sources.
They actually also keep track of newly released funding programs that show up, so that they show up on the radar. They notify us in advance, rather than the vendors coming to us saying, hey, you can use E-rate for this, you can use E-rate for that. They actually, they notify us and help fund those. And they let us know things that would actually help, so that we don't have to, spend full price.
Perhaps you could give us an example of, my recollection is that it was like a 90% discount for the Navy Public, the Navy Free Public Library, when we last talked about it, for the internet.
Yeah, we use
And so is that the rate discount you get?
Yeah.
So if there's a service that's $200,000, an E-rate discount would take care of $180,000 of it, and you'd be left with $20,000.
Yes.
Okay. I say that because as people listen to this, oh, the city wants to hire another consultant. That's just money that's thrown out the door, but it actually helps us to save much more money
Yes.
than the cost of the vendor,
Yes.
if they're actually needed. And I guess what you're saying is these applications have a lot of technical requirements, and they help provide the expertise for us to be able to apply successfully.
Correct.
A little story about why should we do this. Okay, very good. Any further information you want to give to us?
No.
Questions from colleagues on this item? Alder Festa.
Thank you, Mr. Chair. I just want to make note and mention that looks like the contract already started July 1st of 2024, because we are in January. It is 2025, right? And that's 6 months late. Do you want to touch on why this is coming before us 6 months after it was initiated? And how does that work? Because I'm sure it's been used without this board's approval.
It was a renewal. I'm not certain of all the details. Again, I'm coming in February. I'm sure you've all been aware of the difficulties. There have been a lot of other projects that had to catch up, and it takes time before things make it this far. So we had to do the RPQs, the request for prices. I had a lot of catching up to do. I don't have a straight answer for you as why.
And I'm not pointing this to you, but
Yeah,
somewhere down the line,
yeah.
this was not overlooked properly. And I know every time somebody from the Board of Ed comes when we have these questions, it's always an excuse.
I don't want to give you any.
No, and we're tired of hearing them, quite frankly. But again, I just want to point it out because this isn't the first time, and if we're supposed to approve these funds, we need the time to actually.
Understood. This was actually set for December, and it had to get pushed back into January. So I'm not sure how many other pushes it had earlier than that, but I've been playing catch up for the last 11 months.
Yeah, and again, it's not directed towards you, it's directed towards the whole process.
Overall, but the only way to address it is someone's got to stand up and speak about it.
I think I just did.
Yeah. Well,
but we hope you take the message back.
Yeah.
Okay, thank you. And thank you for clarifying as well, Mr. Chair, regarding the 90% discount for libraries, because I think that's important to mention, as well as the discounts or the supports to our students and staff. This doesn't go out to the public though, right? It just is for students, staff, and city?
It's basically for schools and libraries.
Okay. But not students at home that need it?
You mean providing internet?
Yeah.
No.
No, okay, this is separate from this. Okay, perfect, thank you.
Thank you, Alder Festa.
Thank you, Mr. Chair.
And I'll just note that it is true that this item could have been heard like last year, maybe November, December. And we didn't because we had a super long agenda in December. So it's not quite as late as it looks now, but it's still at least a quarter after the fact. So that point remains the same, which we've made to the Board of Ed and will continue to make, which is we do expect more timely presentation of these requests. It's better if the request for contract renewal or a new contract happened before the period that the contract covers, and that's the direction we want the Board of Ed to go in. Any further questions on this item from colleagues? Alder Furlow.
Thank you, Mr. Chair. Thank you for your presentation. Welcome to the hot seat. Just have a quick question regarding how payments are made. You're from purchasing?
Yes.
Just wondering, so it's a $35,000 a year contract. Is the payment made all 3 years at one time, or is it paid yearly? How are these payments made?
Depends on how it was structured in the agreement. Sometimes it's just paid for the year. Sometimes we might get discounts of pay, but it's typically might be for a cost of that is probably just a $35,000 agreement upfront payment for the term.
So this will be paid, so the first payment would have been in July. You'll start at the beginning of the year, or would it be paid at the end of each year consecutively?
It should start at prior to the beginning of the agreement, they should receive a payment. But in this particular case, they didn't receive a payment until after some of at least the Board of Ed had at least acknowledged the agreement.
The full board acknowledged and approved the contract in September. So that whole process had to happen. So E-Rate Online was patient with us through the end of July up to now. So they're continuing to work with us. They even helped me work with the cybersecurity, the federal grant that came up for cybersecurity. So again, they've just been patient while we caught up on other things as well. So lack of admin there.
They've been paid $35,000 already.
They have not been paid because we've had to do this process.
Okay, so the Board of Ed is not going to release the money until we approve this?
Yes.
Very interesting. Okay, thank you. Thank you, Mr. Chair.
Thank you, Alder Furlow. Further questions from colleagues? Alder Punzo.
Thank you for your presentation. Maybe if you could, not now actually, but because of these allocated funds, maybe you could come up with a number of how much money the Board of Ed saved with these discounts. That might be a nice comparison to present, saying that, we saved $100,000 for this cost. So maybe some kind of comparison of what the Board of Ed saved going through E-Rate. Okay. Thank you, Mr. Chair.
I will note your request that you're making through the chair for that follow-up information.
Thank
you. I agree. It makes sense. Return on investment. We are the Finance Committee after all. Questions from colleagues? Seeing none, we thank you for your presentation.
Thank you.
And we invite you to have a seat back in the audience. Thank you. Is there a member of the public who wishes to testify on this item? The contract with E-Rate LLC. E-Rate Online LLC, excuse me. Second request, is there a member of the public who wishes to testify on this item? And for a third time, is there a member of the public who wishes to testify on this item? Seeing none, we're going to move to item 3 in our agenda, which is a request to reclassify positions in the procurement department. Welcome back. Okay. Thank you for being here. And when you're settled, please, names and addresses for the record.
Melinda Figueroa, 55 Oxford Street, New York.
Sean Garris, Southington, Connecticut.
The floor is yours.
Thank you. Just to, we noticed there was an error on the ordinance amendment, and just to correct it for the committee, this is to reclassify 2 positions. It's not to create 2 new positions. So we'll make sure we redline it appropriate and get it to legislative staff.
Thank you for that.
So background on Bureau Purchases has operated with 3 positions total, as you know, from approving the budget. We had a procurement analyst, which was formerly held by the now deputy purchasing agent, Sean Garris, and a contract analyst and a purchasing agent. Us 3 daily are responsible for the daily operations of the department. What we're seeking to do by combining the 2 positions is to have overflow with the responsibilities. The procurement analyst, as you know, we came before you for the OpenGov procurement package. The procurement analyst was solely responsible for the OpenGov solicitations. And then the contract analyst dovetails into that and awards the contracts and works with the departments to execute said contracts from the procurements. We're looking for wraparound services. So the procurement specialist would deal with the departments that they're assigned from procurement to contracting. And vice versa, if someone's out, we have some type of repetitive service going, whether it be medical leave or just for a vacation. Currently, our contract analyst has been on vacation for 11 days. So whatever I can handle during that absence, I've been trying to handle, but most of it will stay in his queue until he returns from vacation, which is tomorrow, thank goodness. So with that, the Bureau of Purchases has initiated citywide digitalization process for city departments. We've utilized prior capital bond funding authorized by the Board of Alder for digitization. Currently, 5 of our departments are going through that. Document retention policy, the city was operating under the Connecticut State Library's record retention policy. We're revamping that to have an internal policy. So not only does it meet the state standards, it's internal controls on the documents that the city is proprietary over. We implemented an e-fax solution, which basically takes the paper out. If most of you, if you still have the dinosaurs living in the office, the fax machine, it just, you get solicitations back to back, the roofers, etc. The West e-fax solution allows it go to an inbox, so it's not automatically printing the faxes. So we're saving sustainability option on that. Again, e-procurement software, we implemented OpenGov April
of last year.
So that's going strong. And then we've initiated vendor insurance tracking through Certificial. It's an application that we're able to maintain the city's liability by monitoring our contractors that do the contracts that we serve, that service the New Haven area, to make sure they are keeping up to date with their insurances and the amounts. And some of our projects require them to hold that insurance for up to 2 years after the project, depending on if it's a design, build, etc. So that helps us track it, and the system will send an email to the broker and let them know it's getting ready to expire, or you don't meet our certain coverages, you need to up it. So it keeps track of that for us. We've also, the Bureau of Purchases was invited by Harvard, the Bloomberg Harvard Business Lab to take part in the procurement, procurement reform back in May. And out of that, we found that we formed the procurement excellence team. We found what our pain points were, and we're working on fixing those. And that dovetails into the retention, the digitization, and onboard, when we onboard new hires, to make sure there's skill enhancement. So they are getting the best training that they can to help implement our policies and procedures, because we found that some of the training was lacking. We were just throwing paperwork at the employees and saying, read it and figure it out. There was no implementation, no sit-down PowerPoint presentation. And that, again, hindered the finance department, such as procurement. When purchase orders were coming through, they weren't meeting certain requirements that are part of the ordinance. So again, just to give you a little background, that's stuff we operate day to day. We also take care of requisitions. From July 1st, current fiscal year to present, we processed 2,902 requisitions, POs. PO modifications, we've done about 60 of those. Solicitations, I think it's more, but I gleaned 50. This is again through from July 1st to present. Contracts, there's been about another 50. Change orders we processed 42. P-card transactions total about 1,800. Office supply orders 150. Request for agreements 239, and Amazon business orders 200. So that's part of our day-to-day, besides the solicitations and the contracting. That's day-to-day operations of the city, and also we control the solicitations and contracts for the Board of Ed as well.
So you've convinced me that you're a busy department, but I'll remind you that you're not asking for additional positions.
No.
You're asking for reclassifications.
Yes.
So is the volume part of the reason why, or you just wanted to give us like a flavor of what's happening in your department?
It's a part of both.
Part of it is after going to Harvard and being exposed to, I guess you call the more of a think tank, more of a broader experience of other procurement agencies throughout the country. One of the things they mentioned was assessing the workload. And that's one of the reasons we looked at it, because procurement is basically is the engine that drives the city. Whether it's Board of Ed here, any supply items needed, services required by the department. So we're responsible for ensuring departments are aware of the policies and procedures for acquiring using public funds. The city has gone through transition, for lack of a better word. It's an aging out of long-term staff members. So there's a lot of new staff members. So after going through this training at Harvard, we came back, made a presentation to the mayor regarding what we learned. So we applied to and received the award. And we brought what we learned, and then made the presentation. He empowered us to PET, and the idea behind that is to improve the procurement process throughout the city. And one of the things we did, we convened a meeting with all the departments because we were getting heavily criticized that procurement is slowing this up, procurement is doing this. And we heard it, we appreciated the comment, but we also gathered from this experience, we started to say, what are your pain points aside from what's purchasing? And we realized we shared a lot of commonality in issues such as skill knowledge in certain areas. Munis is our financial system. When we close out the finances for the year, there's sometimes a lot of issues with invoices, requisitions not clear properly. So what we're doing, we form small teams, and they're working on a particular pain point to resolve, what ultimately will affect the efficiency of the city and how it performs, and the service we're able to provide to constituents, and how we also respond to vendors. Excuse me. Part of that is addressing like the small contractors within the city, working at how we position our solicitations to be more appropriate or smaller for working with smaller businesses. So that's a lot of what we're doing with the PET. But as Melinda has mentioned, this is the kind of to balance the workload, but also get into more analytic and strategic sourcing. And a lot of that also requires us to go out into the departments more, assess their needs, work with them. And we also have insight to what departments need. So we're also looking to break down silos that have traditionally been in the city, people not sharing what each other does. We're aware that some people didn't know the other job functionality and roles of other departments within the city. So it was a good process in helping us move along and trying to improve the overall functioning of the department.
Thank you for that information. Just to clarify, I heard in that narrative that the procurement specialist position, the title, encompasses a broader array of responsibilities.
Right.
Those more general in that respect than the two predecessor titles.
Right.
So if you replace those two different type procurement analyst and contract analyst with procurement specialists, they can cross-cover each other.
Yes.
And they have a broader set of responsibilities.
Yes.
Right? Is it also a higher level of skill and experience that's required for someone to apply for such a position? Or is it essentially the same kind of level of position as the predecessor position?
It's essentially the same.
Okay.
Yeah, we're just, again, trying to make that coverage gap happen and be able to, again, as Sean alluded to, work more with our vendor maintenance and being able to pull the data out, how many New Haven businesses we served, how many we brought in. It's gonna help uplift the department, again, going from a team of 3 to a team of 4. Trying to share all of that.
So you've been down a position for a while.
We haven't been down, it's been for at least past 15 years, there's only been 3 positions.
But we're not adding a position.
We're not adding a position, I'm sorry. The deputy director became the 4th. I'm sorry, I apologize.
Okay. Gotcha. All right. Anything else you want to add before I ask my colleagues if they have questions? Thank you very much. Questions from colleagues on this proposed reclassification of 2 positions in purchasing? Alder Festa.
Thank you, Mr. Chair. Just your department of 4, no vacancies, no.
Right now, we're only a department of 3, and we have a part-time student intern who assists in the afternoons.
There is 1 vacancy, which is procurement analyst.
Okay, so there's 1 vacancy, and it hasn't been filled since
August of 2024.
Okay, so it's not that long, but still long enough to make a difference when it's a small department. Is there hiring that's happening?
No, we decided, Sean was the procurement analyst, and we decided once that position became vacant, this was the ample time to make the change from procurement analyst to procurement specialist. So that created the opening instead of, we're reclassifying instead of asking for new.
But a vacancy is not new. So we will not be filling that vacancy, I guess.
So let's give a little background. So I've been with the department for approximately 17 years. There was been 3 people prior to the former purchasing agent. Prior, the prior controller left, and at that time was the acting. And he had asked me basically what I envisioned, what needed to happen. And I said, we need to expand the department and provide the purchasing with the deputy. So he made that presentation, I believe, last year before prior to him leaving, and the board granted that wish. So the testing occurred, I qualified, interviewed, selected, and began to say, well, go through the process, probationary period again, and then once completed, that position now is opening up, and Melinda was interested in redistributing or allocating the resources differently in the department so we can be more efficient. And that's what she mentioned about the connection between the procurement, from the procurement analyst, procurement contract, switching to procurement specialist, so that if a department, say like engineering, Sean is saying that role as procurement specialist would be the person who would receive the initial information to assemble the solicitation and also follow that through the contracting period. And then the other thing is, with this new application, opened up, you're able to get analytics on the workload of who's submitting and how long things are taking to process through the system. And with that tool, Melinda and I will be able to say, okay, this person is working very effectively, or the workload of, say, Department of Engineering and Board of Ed, one person can't have both of those because the workload is just too great. So this is all in an effort to be more efficient and effective in managing that process.
Okay, so it's basically measuring productivity.
Right.
Okay, thanks for the explanation, because it got a little, I don't know, confusing. Are there 4 positions? Are there 3? But thank you. Regarding, you mentioned there are 5 departments going digital, and I'm assuming going digital will save a lot of time as well. What are those 5 departments, and what is in store for other departments?
Yeah, you have a better.
Okay, so the digitalization process is a citywide initiative, and the idea behind that is that using technology to be more efficient. We spend a lot of time sometimes responding to requests from other departments or community to look at documents. So one of the things is also to save space. we have a vendor called Myers where we store our hard copy documents. And the idea is we're using technology to, one, assist us and other departments in researching statistical statistics to answer a particular question. The departments that have been scanned so far have been Corporation Counsel, LCI, pension, payroll, building department will be scanned, labor relations has been scanned, fair rent has been scanned, parts of police department have been scanned, but it's a very small project. And so from there, that's just one aspect of scanning. The second part is the content management application that's utilized to acquire, say, if you wanted to find something about purchasing document solicitation, you would type in that keyword and it will pull it up. Basically, it would be as similar as a browser search.
Okay, so the public can access information online.
Yes, part of that package would be, there'll be a public facing side, we're able to redact. Workflows, we're looking at workflows to be, again, more efficient. Signage involved in retention policy. There's a long process that different department has to sign. So it's all to help in automating and hopefully cut down on the human error aspect once we get the workflow set up.
I only ask because, you mentioned it's a small department, so a lot of this, once digitized, will also help you.
Yes, we're being everything we're looking to do is help.
Okay. Okay, thank you. Thank you, Mr. Chair.
Thank you, Alder Fessler. Further questions from colleagues on this proposed reclassification of two existing positions to this new title of purchasing, to this title, I'm not sure it's new, of purchasing specialist.
I do have.
Alder Morrison.
I just have one question. It says that the procurement analyst position that's currently vacant and the increase to current salaries is $2,970. So does that mean when the board approved, I guess, this position, I'm not exactly sure where this $2,970 is going.
So the 2,000 is just the difference between the two positions, what they're currently funded at and what the ask is. So it's a $2,000 difference, which is basically taken care of through attrition. Since Sean vacated the position in August, no one's filled it, so it's not going to create a deficit.
So tonight you're not asking, well, I guess the question is tonight you're asking, along with changing the title to procurement specialist for these two positions, are you also asking us to approve this $2,970 increase, or is that already a part of it somewhere else?
It's a part of the 2,970 is just the difference on the fiscal impact statement. It shows what the current positions pay and what I'm asking these two positions to pay, and there's only a $3,000 difference.
Okay.
But that 3,000 again is covered from the August. I mean, it's almost been 6 months since the position's been filled. So I'm not asking for the 3. I'm just showing you it's a difference. It's an increase of 3 that's covered through the current budget.
So in the next budget, this number will be in there somewhere, but right now.
In there, plus you'll have the union percentage increase in July 1 as well, 2025, so.
Okay, so this almost 3,000 is a little more, but we'll deal with that down below. Okay.
Put that in what, March?
I just wanted to be clear on actually what we're voting on. So it's really the, just the two, to reclassify these two positions, and you just gave us some extra information. Okay, thank you, Mr. Chair.
Thank you, Alder Morrison. I'm glad you asked that because it is actually important. In circumstances when staff ask for reclassification and they need extra money to pay for it, they will also ask for a transfer. In this case, because there's a position that's been vacant since August, they're not going to need as much money as they budgeted for their salaries because they have vacancy savings. But next year's budget proposal, those positions will be listed at higher rates than the existing, so the fiscal impact will be felt next year. So if we approve it, we're just approving a change in the listing of the
the positions in the budget, because our budget is such that every single position in the general fund budget is listed and is part of the budget. So this changes the listing. We can afford it this year because the position's been vacant since August. But next year, it'll be more than it would otherwise be if we didn't approve this. So there will be a fiscal impact. But we don't have a transfer request because it's not needed at this time.
All right, thank you, thank you.
So the board could decide, well, we don't want those positions to be more expensive next year, let's not approve this. Or we could say, this different position sounds useful and helpful to the department and support it. Further questions from colleagues on this item? Further questions from colleagues? Seeing none, we thank you for your presentation. Thank you. And we'll ask if there's a member of the public who wishes to testify on this proposed reclassification. If so, please come forward. Is there a member of the public who wishes to testify on this item? The reclassification of these two positions in the purchasing department. And for a third time, is there a member of the public who wishes to testify on this item? Seeing none, we're going to move to item number 4 this evening, which is more positions to be reclassified should we approve it. And these positions are in public safety communications and in engineering. I see we have more staff coming forward, so we'll wait for them. But while we're waiting, you may introduce yourselves and give us your names and addresses.
Rebecca Bombero, Deputy Chief Administrative Officer, 122 West Drive Ave, 425 New Haven.
I'm Giovanni Zinn, I'm the City Engineer, 95 Sound Beach Terrace.
Joseph Igali, 378 Townsend Avenue, New Haven, Connecticut.
Eileen Parlato, East Haven, Connecticut. First, I want to introduce our new deputy for PSAP. This is the new administrative deputy that you guys created in this year's budget. Eileen has hit the ground running and is already making a difference on our training and hiring and our compliance and FOIA. So we're really excited to have her, and you're seeing great things as a result of that new position. So like purchasing, we're here today because we have a couple new vacant positions or anticipated vacancies, and a best practice is to review those vacancies when they occur to determine if it's the right position. So in these instances, we have vacancies where we think there is a different title which will be better suited for us. So the first is over at PSAP. We have the title of Dispatch Operator 3. It's actually a title that has been sunsetting since the department was civilianized in 2007. So the incumbents that existed at that time in that title remained with us. And as they have left the service of the city, they have been replaced. Most often it is replaced by just a dispatcher. What happened back then is we required everybody to become cross-trained. Our dispatcher 3s had been the most senior members of the department. They had the most level of training, and they were also qualified to work as a supervisor if there was a vacancy that couldn't be filled as supervisor. So what we found over time is as we've lost more and more dispatcher 3s, we've had stress at the position of supervisor. So we're asking at this time to take one of the last remaining dispatcher 3s and convert that title to a supervisor. We had asked for the supervisor title in the last budget. It will help in terms of coverage. So as people take vacation days and sick days, we won't have to backfill it with overtime, or our two wonderful supervisors here that fill those shifts on New Year's Eve and Christmas Eve and whenever they can mandate somebody to cover it. And it will also help us with a lot of our administrative requirements. FOIA takes up a lot of our supervisors' time, and it'll help us be proactive in our audits of position calls and all of that we do. And I will turn it over to Joe and I mean talk a little bit about more about it.
So good evening. So this operator 3 position sunsetted and it was eliminated out of the 2010 contract. So as we have retirements, we can no longer test for an operator 3. Operator 3, like Becky said, is able to work as a supervisor when needed. The rest of the time, we're working as an 884 member. It's a $3,795 difference per year in in their salary. An operator 3 makes more money than an operator 2, of course, and they're very, very close to the supervisor's position. So what we're saying here is we're having a very, very tough time filling our positions when we have somebody who wants to have a vacation, if somebody's out sick, if there's some sort of long-term medical or any type of long-term absence. We're running very, very short. As you know, the center gets busier every year. We topped off this year from January 1 to December 31st. We answered 471,000 911 and non-emergency calls for the center with 36 employees. We also had a deficit of, we're short 16 dispatchers through the year. Again, with the addition of Eileen, and we ran a test in June. We've been quickly filling these positions. We're down to absolutely five positions left. We started a new class today of 3. This position that we're asking for the transfer, we're not looking to add any positions within the PSAP. It's going to be the same budget position number, just transferred from dispatch 3, which we cannot hire anymore or test for anymore, to a supervisor. Now, one thing to say, when we do that position within the supervisor's position, that supervisor can cover for a dispatcher, so they can go backwards. We're on track. Our goal for this year is to have our department fully staffed, and we're not stopping until it's fully staffed. So we started this fiscal year with approximately 16 short. We've hired, we've also lost, we've gone up and down. We've lost people within the training process. We've also lost people to other departments. So that number of 16 really isn't it's not a static number. It moves all the time. But with the addition of Eileen in our full-time training department, that's also run by a supervisor, we're going to hit that goal this year.
All right, second part of the order. So we have the position of CAD technician in the engineering department. A longtime employee gave us ample warning of a retirement that will be later this month. So again, we sat down and reviewed the position. CAD technician actually goes back to when computers were fairly new, and engineers would scribble their designs and plans on paper, and the technician would then help to computerize those. Most of design work now is done start to finish on the computer, so the CAD technician's role has changed over time, and as such, we want to update and modernize the job title to help us with recruitment and also to better match the needs of the department. Really use data as a tool and improve the communication and transparency in the department. So with that, I will turn it over to Giovanni to talk a little bit about the new position, the new title, and its need.
Thank you. I think you covered 98% of what I was going to say, other than to say that data is incredibly important. Also using geographic information systems, or GIS. It's incredibly important using interactive maps. So for example, a map of the city storm system, I can click on a pipe and I get a whole list of data, when it was installed, its size, its depth, and other information that's very useful. So having someone in the department that can manage these data sets for us and create them and curate them, they're only as good as the quality of the data that you have, is incredibly important. As Becky said, CAD technician is something that more or less doesn't exist in our industry anymore.
So the mechanics of it, since you guys are the finance committee, like in purchasing, we do have a lot of lap salary over at PSAP that will account for the slight difference between the operator 3 and the supervisor. That is something, even though, Joe talks about the goal of filling the positions, We do see lapse over in the department every year. So even if you approve this on a go-forward basis, I think you will have that wiggle room in next year's budget as well. The second, over at engineering, it is a new title, so it is still in the classification process. It has to be approved by the union and the Civil Service Board. But the union contract is such that we anticipate it will be similarly classified and therefore in the same range, and it will be filled based on union contract rules and budget. So
it'll be in the same sort of numerical range. It'll probably be in a different salary range due to the description and the duties.
So no fiscal impact anticipated on that position. And we're happy to answer any questions you might have.
Thank you for that presentation. We're grateful for it. We're going to now have questions from colleagues, starting with Alder Morrison.
Thank you. Thank you for your presentation. This is just a question to PSAP in regards to the work. Earlier, we talked about the compass and the work that you guys have been doing there. So my question is, how has your work been affected with including the direct compass referrals or, inquiries? As we're looking at this whole reclassification and the need to be able to have the wiggle room to go back and forth and to hire.
So at the very beginning, when we started with the direct dispatch, there was a training curve. Now it seems to be working out. The dispatchers are getting comfortable with it, and the supervisors are there to provide guidance if there's any questions during these calls for direct dispatch. Because again, Compass is going out, direct dispatch from PD. They're going out at the request of PD, and they're also going out at the request of the fire department. So there's 3 different ways of that being sent. The direct dispatch was the largest learning curve. I think we're doing a decent job at it. I don't see any issues. We met again today at our Monday 9:30 meeting with the Compass team and community services. And again, like my colleagues from community services, we have a great working relationship together. So anything that is questioned, we get together pretty quick and work it out.
So you feel like this reclassification?
So the reclassification is going to help because of the pressure on the supervisors in the room. And one other thing I'd just like to add about that, and no disrespect to my 9 to 5 colleagues here, but the position that is filled, and I'm saying it in a specific way, if I don't fill that position is going to get filled on overtime. So this new supervisor's position will go right into the wheel, and they're going to fill the gaps where I would have to fill them with an overtime position. I don't have any choice. We can't run a room without a supervisor. Like Becky said, Deputy Director, and myself, we spent Christmas Eve morning from 4 o'clock in the morning till 11 o'clock in the morning working in the PSAP just because of shortages of supervision. We will not let the room go without a supervisor or 2. Sometimes we're lucky that we even make it through with 2 based on the call volume and the type of day. So again, anytime the position would be open, it will be filled with overtime. So it's not a luxury. We're just asking to have an extra employee there so that we're filling the gaps, we're able to allow for overtime, we're able to fill these requests in a timely manner, because most of the times we can't fill vacation requests unless we get another supervisor who's willing to work the shifts that are being requested time off. So it adds to the program.
Thank you. Thank you.
All set, Alder Morrison?
All set. Thank you.
Thank you very much. Next on the queue is Alder Festa, and after that, the queue is open.
Thank you, Mr. Chair. Just, I kind of, get a little bit when I hear no fiscal impact to the budget. That's for this fiscal year, because then, we shouldn't really depend on vacancies to make up salaries, particularly because Mr. Vitale noted that he'd like to fill all of those vacancies within his department. So I'm assuming we will see March 1st budget have an increase of the difference of, what was it, over $3,000, $36.85.
So as they mentioned, it's twofold. You will see that slight difference, but generally speaking, in PSAP, we do lapse positions just because of the churn. It has a high rate of burnout. There are a couple operator threes left that have been there long enough to have made it up to the top of the ranks and still, since 2010 have been working their way up even further. So there's folks that are getting near retirement in that regard. But also, as they indicated, we need to fill those chairs one way or another. So when we have these positions, it does help take pressure off the overtime budget as well.
Right, and we've been doing that for years, as we all know, with the police department and fire, but, still, I guess, I want to be confident that we're going to be fully staffed at some point in time, and we have to keep in mind that if that miracle were to happen, we have to include that increase.
The $3,000, yes.
I mean, and that's just in general with everything, even the previous presentation that we had. With that being said, what the overtime budget, well, you know what, you're coming before us during budget season, so we can discuss overtime at that point. Regarding, though, these vacancies that you mentioned, you're down 5 now, you said?
We're down 5 operator dispatchers,
Okay.
not supervisors.
And how many supervisors are we doing?
Just one.
Just one. So we're down 1 supervisor and then the 5 vacancies.
For operator dispatchers. Yes.
And the dispatchers, they're the same dispatchers that cover 911 and non-emergency, correct? So it's not like you have a group for one and a group for another, they cover.
We do have call takers that answer the phones and dispatchers who dispatch police and fire. And they start out as call takers and then they get cross-trained into the other specialties.
Because there's been complaints from constituents regarding no one answering the non-emergency number. They keep calling back, so I'm not sure, what the challenge is there. But that's been a complaint. I don't know if others have. I figure you're here now, address it so you know.
Particularly how having this particular position as a supervisor might help that.
Okay.
We will, as you mentioned, Alder Festa, see them again in the budget. So we can certainly anticipate that coming up again, but I will allow you to respond.
So I'll start off with what I mentioned before. We're at 471,000 phone calls. And these are hard numbers that are coming out of our computer system for our phones. We've taken in that many phone calls, both 911 and non-emergency. Supervision in the room is extremely important, and also having a supervisor who's not burnt out that we allow to take a vacation, or when another supervisor takes a sick day, we're not burdening another supervisor. Because you have to remember, our supervisors do not work 8-hour shifts, they work 12-hour shifts. So they're working 12 on, 3 12s on, 3 12s off. So it weighs on you. Then the other issue we have with that is because it's a 12-hour shift, we can't have anybody work over 16 hours. So now we're trying to mend 2 shifts together. So the supervision in the room and having somebody that's fresh in the room is extremely important. And again, when I am short somebody, we have to hire somebody. So it does come at a cost of the overtime.
And just to clarify, the call takers take both the 911 calls and answer the non-emergency line. So the 911 calls will always take precedent. If you're calling the non-emergency line and there's not an operator available and the 911 line is ringing, they're taking the 911 call.
And that's the explanation I think most of us are giving to residents who call us to complain, why isn't anyone answering the non-emergency number? And we tell them it's the same dispatchers who answer 911 and that takes priority. But if the call comes in a couple times, do you call that number back?
I was just going to address that. They're called abandoned calls, and the abandoned calls come up on the screen, and we do call them back. If they let the phone ring long enough for it to go through the system, even if we are not able to answer it in time, it comes up as an abandoned call. And we do make the abandoned return calls.
I'm gonna say, is there a voicemail too?
There's no voicemail, meaning you can leave a message, but there is a phone reading that tells you what to press, what button to press if you're calling the non-emergency number. So the 911 call, if you allow it to ring, and when our call taker does get to the phone call, we'll answer it. And right now we're well within the state regulation. We're answering 90% of our 911 calls within 10 seconds. And that's how we get our state money based on these numbers. So they are real numbers.
Yeah, the concern was mostly with the non-emergency.
No, I understand that. And believe me,
The supervisor would be able to help with those abandoned calls when the call takers are overwhelmed. The supervisor is capable of also calling back those abandoned phone calls.
Okay, that's helpful.
and they do that. They have the same exact equipment at their desk.
Okay, that's helpful. Thank you. Thank you, Mr. Chair.
Thank you, Alder Festa. Alder Furlow.
Thank you, Mr. Chair. Thank you for your presentation. Thank you for all you do. I worked in PSAT during my college years.
Okay.
And so I know how much work that is. I only did it for a couple months during the summer and I had to get out of there because it was just a lot.
I appreciate it.
And I understand the importance of having a supervisor there, whether it's Holly Berry or that works out, if you saw the movie. But just to get back to more technical, these, and I'm sorry for my ignorance for this, but these are union positions?
Yes.
Okay, and I know you said it in the beginning, would you just give me one more high-level explanation of the process of hiring for this position once we approve it?
Sure. So these are all governed by civil service. There is an existing job description. So the supervisor is tested. We recently had an expired list, and that's why we do have one vacancy right now. It is currently posted in an effort to fill that one vacancy. So when the title is, if approved, changed, we will already be in process of certifying the list for supervisor, and it will be off that list.
Oh, so this does not have to go through
the 911, the titles already exist. The dispatch 3 has sunset, so that position doesn't exist anymore. So we could choose from either, the dispatch 2 or the supervisor. And in this instance, we need the supervisor.
Got it. Okay, got it. Thank you. Thank you, Mr. Chair.
Thank you, Alder Furlow. Further questions from colleagues on this request? Further questions from colleagues? Seeing none, we thank you for your time and your presentation.
Thank you.
Thank you.
And we'll ask if there's a member of the public who wishes to testify on this item or any of the items we've heard this evening. In the second request, is there a member of the public who wishes to testify on this item? And for a third time, is there a member of the public who wishes to testify on this item? Seeing none, a motion is appropriate. Alder DeCole.
Thank you, Mr. Chair. I move to close the public portion of this meeting.
Second.
Motion's been made to close the public portion, seconded. Any discussion of the motion? Seeing none, all in favor, please say aye. Aye. All opposed, say nay. The motion carries. We are now past the public portion. That means no more public testimony. You're still welcome to stay to the end of the meeting. We will now proceed to deliberations. Alder DeCole.
Thank you, Mr. Chair. I move item 1 favorable.
Second.
Item 1 has been moved and seconded. This is the extending for another year, the contract with Yale and the Elm City Compass program. Discussion, Alder DeCola and then Alder Morrison.
Thank you, Mr. Chair. I think this is a great program. It had a bunch of bumps in the road, but they're now leveling it out and we're moving in the right direction for the purpose of this Compass program, so I'm all in favor. Thank you, Mr. Chair.
Thank you, Alder DeCola. Alder Morrison.
Yes, I am in support of this item. I was the alder selected by our president to work with this group during COVID to get this program off the ground, and to see it go from where it started from, 8 to 5 basically, to almost 24 hours that is just the best thing, because our residents are really being serviced. And I feel as a board, we need to do anything that we can do to support this process, because it takes a lot of pressure off of different departments as talked about tonight. And also it gives our residents a familiar face to look at when they're going through times of crisis. So I support this item, and I hope the rest of this committee will support it. Thank you.
Thank you, Alder Morrison. Further discussion from colleagues? Alder Festa?
Thank you, Mr. Chair. I support, the item before us. I just want to make sure that once the data system, which it's sad that, sometimes attorneys get involved and they have to feud this out, but having the data would have been nice for us to see the success of how it's working. And I look forward to that report once, I guess, the year is up, or maybe a 6 month or whatever, however we decide, Mr. Chair, on how to get us that information. So that was a little bothersome, but that's the politics and the bureaucracy of some of this stuff. But I'm happy to have looked at the maps on how Compass is being utilized throughout the city, and look forward to seeing, additional support, because there are some areas that feel like they're being neglected, but we see the work that's being done out there. It's been successful, and look forward to seeing more successes and some of the challenges that get conquered as well. Thank you.
Thank you, Alder Festa. Further comments? I see Alder Hamilton on the queue.
Thank you, Chair Marchand. I'm also in support of the item. Compasses, there were some bumps in the road, but as we see, they're making a difference in our communities, to our residents. And for that, I want to see them continue. So I'm in full support of the item and ask colleagues to support it as well. Thank you.
Thank you, Alder Hamilton. Further discussion from colleagues? Seeing none, I'll just note that the next time we will have an occasion to hear from the Community Services Administration will likely be during our budget workshops. And so we'll see what update is ready at that point. I would be glad to talk with leadership about what an appropriate follow-up meeting would be. It may not actually be from finance, that we have to the president. If it's programmatic and not monetary, then it may not actually be this committee. It could be human services, it could be public safety, it could be some other thing. I think the question that's really important for this committee is, once the organization, the city that is, has enough data and enough analysis of that data to make a proposal, an informed proposal about how to structure a sustainable program going forward, what would the funding streams be, then certainly this committee gets involved, especially if it's general funds. But it may not be. So I think in our budget process, we'll ask a follow-up question, but I think in terms of who's the appropriate group of individuals or committee to look at this, it may not actually be finance, but I'll be glad to talk with leadership about that. And I'm also in favor of this item. Any further discussion? Seeing none, all in favor, please say aye. Aye. All opposed say nay. The ayes have it. It will go forward with a favorable recommendation. Alder DeCola.
Thank you, Mr. Chair. I move item 2 favorably.
Second.
Item 2 has been moved and seconded. This is the multi-year agreement between the Board of Education, the city, and the E-Rate Online LLC. Discussion of this item. Alder Morrison.
Thank you, Mr. Chair. I am in support of this item. As the alder representative for the boards or the library, I see how being a part of this E-Rate online system really is beneficial. When I look at like almost like a membership cost, if you want discounts, you got to pay, but I think it's really, really helpful to make sure that we do anything that we can to get discounts in order to provide the best of services, especially to our children that we can. So I am in support of this item, and I hope the rest of the committee will be too.
Thank you, Alder Morrison. Next on the queue is Alder Festa, followed by Alder Punzo.
Thank you, Mr. Chair. As my colleague mentioned, first of all, I'm in support of this item. The only concern that I have is the time period, which was July 1st of 2024. And I only mention that because these timelines are important because it could affect the services that we receive from these companies. And it sounds like the, E-Rate Online LLC has been understanding of our needs, meaning that they haven't charged us yet until this item gets approved and follows the process. But that doesn't happen all the time. And we have to be cognizant of these deadlines because it could affect services that we receive. It could affect our billing. It could affect so many other things. It's like if you don't pay your mortgage, they come after you the day after it's due. And, so for that reason, we really need all departments, Board of Ed in particular, to be on top of these contract deadlines so we can move and be proficient with our services. But again, I'm in favor of the item itself. Thank you.
Thank you, Alder Festa. Alder Punzo.
Thank you, Mr. Chair. I'm also in favor of this item, but probably next time their presentation would be nice to know, E-Rate Online LLC, the discounts that they give the Board of Ed. It would be nice in comparison of what it would have cost without the discount. So, when you're asking for money, it certainly helps. Thank you, Mr. Chair.
Thank you, Alder Punzo. I think you made that point well during the meeting and now, and I appreciate it. Further questions, further discussion from colleagues on item 2. Seeing none, all in favor of the motion, please say aye. Aye. All opposed, say nay. The motion carries. The item will be given a favorable recommendation to the full board. Alder DeCola.
Thank you, Mr. Chair. I move item 3 favorable.
Second.
Item 3 has been moved and seconded. This is the request to reclassify those 2 positions in purchasing to procurement specialist. The queue is open. I see Alder Morrison.
Thank you, Mr. Chair. I am also in support of this item with the way that things are constantly moving and the amount of work that everyone has to do. I think it's important that this board make things as easy as possible with titles to allow staff to go back and forth in their work. In their work. And so in making these 2 positions into this one general title, I think is best, because this way you keep a person that's going to help you from beginning to end and allow these contracts to get out and the services that need to be rendered to be in place. And so again, I am in support of this item, and I hope that the rest of this committee will also support it. Thank you.
Thank you, Alder Morrison. Further discussion from colleagues on this item? Seeing none, before I call for a vote, I will note that the resolution that was given to us needs to be prepared. We heard a commitment from Director Figueroa to provide us a new resolution that makes it clear it's a reclassification and not additional positions. I will follow up with the staff to make sure that we have that and that we can make that amendment from the floor at the second reading. I think we all understand the intention, and so we're going to move this motion, vote on this motion based on the intention, but I'll commit to make sure that we have the corrected item in time for the second reading. Any further discussion? Seeing none, all in favor of the motion, please say aye. Aye. All opposed, say nay. It passes. The item will go forward with a favorable recommendation. Alder DeCola.
Thank you, Mr. Chair. I move item 4 favorably.
Second.
Item 4 has been moved and seconded. Discussion of the item, additional positions to be reclassified. Alder Morrison.
Again, I do support this item. Reclassifying any position always allows the system in itself to run more fluid. And as as testified tonight, there are certain, especially with PSAP, there are certain positions that have to be on those floors at all times because this is a 24-hour a day job. And so to be able to help them be able to provide more freedom and influence within this department, I think, again, as a board, we have a responsibility to make those changes as they come up. So again, I do agree. I am in support with this item, and I hope the rest of the committee can support it.
Thank you, Alder Morrison. Further discussion of this item? Alder Festa, then Alder Punzo.
Thank you, Mr. Chair. It sounds like I'm in support of these changes. It sounds like with PSAP, by changing it to communication supervisor, it will also help with some of the challenges that they're facing in running the department, particularly between 911 calls, non-emergency calls, and the 400K plus K calls that they get, that they have received. And then, you know, as technology advances, so do the needs of a department. So I can understand the title changes even for the engineering department. I mean, CAD, I think, came out in the 90s, if I'm not mistaken. But anyway, technology advances so quickly that it's good to keep up with those changes as well. So I support these items. Thank you.
Thank you, Alder Festa. Alder Punzo.
Thank you, Mr. Chair. I'm in favor of both reclassifications in both engineering and PSAP. I just want to make a point that last week I had a call, a non-emergency number. I spoke to a young lady who was very, very nice, and the question I asked her, she referred me to a supervisor who was also very knowledgeable and very nice, and within an hour the problem was taken care of. Thank you, Mr. Chair.
Thank you, Alder Punzo. Further comments from colleagues on these proposed reclassifications? Seeing none, all in favor of the motion, please say aye. Aye. All opposed, say nay. The motion carries. It will go forward with a favorable recommendation. And before our motion to adjourn is appropriate, let me just remind colleagues that it's not too much longer before the next budget process begins. Our first meeting in March will be that second Monday of March. That will be the first meeting in the budget process. Stay tuned for announcements about potential trainings that we may offer related to the budget in the month of February. Also, please know that Vice Chair DeCola and I are looking to finalize the schedule of additional meetings that we have every year in relation to the budget. We need to do that this week. I've consulted with Madam President. So hopefully by the end of the week, we'll be able to let everybody know what the full schedule of meetings will be this spring, because it's always more than just the monthly meetings, of course. So stay tuned for that update. Alder DeCola.
Mr. Chair, thank you. I move that we adjourn.
Second.
Motion's been made and seconded. Any discussion? Seeing none, all in favor of the motion to adjourn, please say aye. Aye. All opposed, say nay. The motion carries. We are adjourned.